and welcome to NHIS in a Week. We bring you highlights of events within the authority and the scheme. My name is Vida Educhimwa Boateng. Now the headlines. Dr. Okoboy pays courtesy call on Chief of Defence Staff. The Upper West Regional Minister, Dr. Hafiz bin Saleh, says Dr. Okoboy's elevation as Health Minister is commendable. The Dafiama, Busi Isa, Yagba, and Laura district officers have been commissioned. The CEO also unveils Customer Experience Point, also known as the Pulpit. Now, the details. The Chief Executive of the National Health Insurance Authority, Dr. Okoboy, has paid a working visit to the Chief of Defence Staff, Lieutenant General Opompepra, at his office in Burma Camp, Accra. The purpose of the visit was to congratulate Lieutenant General Opompepra on his new role as the Chief of Defence Staff and his elevation to the rank of Lieutenant General. During the visit, Dr. Okoboy also extended an official invitation to him to the launch of his new book titled Fellow Ghanaians, Telling Ghana's COVID-19 Story, a journey of fear, facts, faith and fortune. The book details Ghana's efforts in combating COVID-19, highlighting the country's fight against the pandemic and the role of Ghana Armed Forces in this endeavor and how the country can better prepare for any pandemics in the future. The book is forwarded by the President of the Republic, Nana Addo Dankwa Akufo-Addo, and will be officially launched on March 20th, 2024.
We work closely with Tommy. You have a good number of health facilities across the country, from MRS to other regional stations to the 37 military itself. And because of that, the medical department or division is an important stakeholder in our things. And so I usually come to the CDS who takes office to let them know that we are friends. If there are issues, we sit at the top and see how to address them. Once we address issues, the ordinary Ghanaian and the soldier will be better off. So I just came to reassure you that that relationship is there. And that anytime we need to talk, my doors are open.
On my appointment as the Chief of the Defence Staff, and also on my promotion from Major General to Lieutenant General. It is a sign of goodwill, and I know that it's the beginning of our relationship, and also an opportunity for us to build on the already well-established relationship that my predecessor went through.
The Upper West Regional Minister, Dr. Hafiz bin Saleh, has praised the President, Nana Addo Dankwa Akufo-Addo, for appointing Dr. Bernard Okoboy as the Minister-Designate for Health. He spoke to a high-level delegation from the National Health Insurance Authority at his office. Dr. Okoboy reiterated that the region was part of the government's top priority and that infrastructure was being expanded to make healthcare more accessible to residents. He urged collaboration among various players in the health sector to pursue the national goal of achieving universal health coverage, also known as UHC, by 2030. The new NHIS offices will make it easier for employees to improve their performance, he said.
This afternoon. This should have taken place a few days ago, but as indicated by my brother, His Excellency the President had to assign all of us on Monday to perform a duty on his behalf. So we had to liaise and then postpone this event to today. Hardly did we know that when we will meet my good friend and I will be celebrating. We were both ministers. He exited, and fortunately, he's come back to meet. So I want to seize the opportunity to first congratulate him warmly for his nomination to be the Minister in charge of health.
And because the executive management and the staff we have a national health insurance scheme are action-oriented people, all the projects and programs that we sort of mentioned that time, we work hard to follow through. And some, I'm happy to see that inshallah, some are ready for outdooring and for use. And, we are here to push through with that particular agenda, and also to fulfill the President, His Excellency Mr. assurance that any project that has been touched will be pursued to the very end.
Dr. Bernard Okoboy has officially commissioned the newly constructed National Health Insurance Scheme district offices in Dafiama, Busi, Isa, and Laura. During a working visit to the Upper West region, he pledged to provide all inhabitants with access to quality healthcare services, as well as to enhance the region's health infrastructure.
We are here to have a befitting office. This is what matches the status of Laura as one of the most favored and interesting communities in the whole of the Northern Belt. So congratulations to all of us. You know, I have 3 deputies. Right now, Chairman, when I was coming, I have 2 beautiful ladies as deputies. Madame Yapokwa is the deputy for admin HR. She's here. And recently I got another deputy, Mrs. Reza Tachman. The third one is a man, it's a male, so I left him in Accra. Yes, I came with the 2. Usually when we are coming, we leave him to handle matters back in Accra. And I like to appreciate all of them. They are all part of this success story. Now, Chairman, if building an office is that simple and easy, this would have been built 30 years ago. And it's just to remind all of us that a lot of people have worked hard to make sure that we have this particular edifice.
Oh, yes. Wow. Thank you. This is gorgeous. And a beautiful.
An ultra-modern office space in Yagba in the Northeast region has been commissioned. Dr. Okoboy, CEO of the National Health Insurance Authority, also presented a new Toyota Hilux pickup to the Tripoli District Office. The event was attended by high-profile dignitaries and reflects NHIA's commitment to providing healthcare access to all members.
Now, this is the reason. If you have leaders, MPs, who are very industrious, who would push and follow through with projects, you can be very far from Jubilee House, but you get whatever you want. And like he said, although we are all part of the same government, relationship is also very important. So he's my brother. If he tells me, doctor, let's try and do something, because of our relationship, I'll put in my effort. And I'm happy to hear that this community, through its hard work, is getting one of the Agenda 101 district hospitals. So as I go to the Ministry of Health, maybe that will be the first one I will try and commission.
Still in the northern part of Ghana, the NHIA has unveiled the Customer Service Point, also known as the Pulpit Initiative at Damango in the Savannah region. The aim is to enhance the experience of NHIS members seeking healthcare. The initiative will have NHIS staff present at credentialed healthcare facilities to serve as the first point of contact for legitimate concerns. It is also to mitigate the issue of illegal charges demanded by some healthcare providers for services covered by the scheme. The NHIA has further inaugurated 6 new ultra-modern regional and district offices in the northern part of the country. The offices, which were part of the NHIA infrastructure expansion, were inaugurated by the CEO, Dr. Okoboy. The offices were part of the NHI's efforts to transform the country's health sector. Dr. Okoboy emphasized the importance of health insurance for assessing quality and affordable healthcare services. He also declared zero tolerance for extra monetary demands from some NHIA credentialed healthcare service providers for services covered by the NHIS.
I'm also happy that this is one of the projects that was thought of before the Kufuor administration, but was not abandoned. So it was thought of, like Honorable MP said, somewhere in 2016, she lobbied for it, but nobody said because it was thought of in another government's time, we will let it lie down. We have pushed, and together we all must be proud of ourselves that we have put it up finally and it's ready for use.
This past Valentine's Day, the Greater Accra Regional Office staff of the National Health Insurance Authority in Jowlu celebrated the benefits of the My NHIS app. They engaged with residents distributing pocket cards, wristbands, and encouraging registration for the National Health Insurance Scheme. The event emphasized the importance of healthcare coverage and the convenience associated with the use of the My NHIS app. The event was a successful way to connect with the community, promote love, promote awareness about the benefits of the National Health Insurance Scheme.
So this is what the icon looks like when you download. And then when you so this is mine. So it has mine. I have registered. Okay. So we'll give you there's a process. I have registered.
The National Health Insurance Authority intends to incorporate mental health care within the NHIS benefit package by the end of 2024. The decision is in response to President Nana Addo Dankwa Akufo-Addo's concern about the plight of mental health patients. Stakeholders from the Ghana Health Service, Ghana Mental Health Authority, Ghana Psychological Council, and CHAG believe that the inclusion will lessen the burden of mental health illness and lower the financial barriers to healthcare access. This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screen. My name is Vida Iduchimwa Boateng. Thanks for watching.